Directional terms. There's a table in your book that looks something like this. And there's a diagram like that shows some of them. And on this model, I might ask, the nose is blank to the mouth. And you put superior. The eyes are blank to the mouth. Now you could put superior or lateral would also work. Turn the model around like this. The sternum is anterior to the vertebrae. Or the sternum is ventral to the vertebrae. Use those terms interchangeably. The pectoralis muscle is medial to the deltoid muscle, maybe also a little inferior. The deltoid muscle is lateral, it's towards the sides of the pectoralis muscle. So medial means towards the middle of the body, lateral means towards the sides. Also, the sternum is medial to the pectoralis muscle. The pectoralis muscle is lateral to the sternum. And the arms and legs, you might think that the wrist is inferior to the elbow. But that's not a good term to use on the arms and the legs because they can move around a lot. What if you raise your arm above your head? Or maybe like this, the wrist really isn't inferior to the elbow anymore. So for the arms and the legs, you have to use terms proximal and distal. The wrist is distal to the elbow. The wrist is further away from the body than the elbow. The deltoid muscle is proximal to the elbow. The deltoid muscle is closer to the body than the elbow. Another couple of terms, superficial and deep. This is a skin model. This layer is called the epidermis. And the epidermis is superficial to this layer, which is the dermis. Superficial, closer to the surface of the skin. This stuff down here is adipose tissue. It's in a layer called the hypodermis. And the hypodermis is deep when compared to the dermis. The hypodermis is deep compared to the dermis.